Hello everyone, I'm Mina. Thanks for coming back to my channel for another English lesson. This lesson is quite different from previous lessons on my channel. I'm gonna give you some English information about the disease COVID-19. As you know, I'm not a doctor, I'm an English teacher. What I'm gonna help you with is to express yourself clearly and understand the medical authorities and the media when they are talking about COVID-19 or coronavirus disease 2019. Coronavirus, COVID-19, coronavirus disease 2019. The new coronavirus. First of all, what are the symptoms of this disease? The word symptom means the signs that your body shows when you have this illness or disease. Let's pronounce it correctly. Symptom. Symptom. There is a P here, but you don't have to pronounce it. English is a lazy language. So, what are the symptoms? Cough. You can say, she has a cough. Use the verb have or has according to your subject. For I, you, we, and they, use have. For he, she, and it, use has. Another common symptom is sneeze. You can say, she is sneezing. They are sneezing. This time, you have to use be verb, am is are, and sneezing. It's advised to use the bend of your elbow to sneeze or cough. This is your elbow, and here is the bend of your elbow, like this. Or fever or temperature. When your body is hotter than normal, you can say, he has a fever. Again, use the verbs have or has according to your subject. For I, you, we, and they, use have. For she, he, and it, use has. You can also say, he's running a temperature. If somebody has a fever, the question, what's his or her temperature, is a very common one. So let's practice it. What's his temperature? It's 39 degrees. He has a fever of 39 degrees. His temperature is 39 degrees. All right? So, what are some other common symptoms? Fatigue, body ache, shortness of breath, or difficulty breathing. Fatigue means very tired. You can say, he is tired. Body ache means to have pain all over your body. You can say, his body hurts, or he has pain in his body. To breathe is okay? And to take a deep breath is, if you have shortness of breath or difficulty breathing, it is hard for you to breathe. You can't take a deep breath. If you take a deep breath, you have difficulty or pain in your chest, in this part of your body. All right? Of course, these are just some of the symptoms. If somebody has these symptoms, maybe, we are not sure, maybe she or he has the coronavirus. To say whether somebody has this illness or not, you can say, she has COVID-19. She has coronavirus, or she has the coronavirus. She tested positive for the coronavirus. And in negative forms, you can say, She doesn't have COVID-19. She doesn't have coronavirus, or she doesn't have the coronavirus. She tested negative for the coronavirus. We all know that the coronavirus outbreak started in China. It spread and became an epidemic. Right now, the world is facing coronavirus pandemic. The three words outbreak, epidemic, and pandemic are commonly heard. Outbreak as a noun means a sudden increase in occurrences of a disease, here COVID-19. Epidemic as a noun again means the outbreak of a disease that spreads so fast and attacks many people. It's the rapid spread of COVID-19 to large number of people. And the word pandemic is an epidemic of an infectious disease that has spread worldwide or across multiple countries or continents. It's affecting substantial number of people. So, outbreak refers to a small group of affected people. Epidemic refers to a larger group. And the word pandemic is used when the disease becomes a global problem. Okay? To limit the transition of the virus, people with symptoms or a positive COVID-19 test are asked to stay away from other people, isolate themselves, to be in quarantine. If you develop the symptoms, you are asked to self-isolate or self-quarantine. To develop symptoms means to start to have symptoms. All right, where you live might be under lockdown, or in lockdown, or on lockdown. All the three prepositions are completely correct. It means businesses, restaurants, cafes, schools are shut down. You might hear, the government has declared a lockdown. However, essential businesses are allowed to keep working. What does this verb mean? To declare means to announce something officially, to say something officially. Essential businesses are allowed to be open. Essential businesses, important businesses like supermarkets, they can be open. International traveling has been banned. Commuting to work has been restricted. To ban something means to completely stop something. No one can travel to other countries. Traveling to other cities and commuting to work have been restricted. It means you can travel to work or you can travel to other cities, but there is a limit. Maybe only doctors and nurses can do this. Health authorities have asked to avoid any unnecessary contacts with others. Avoid parties or gatherings which are not necessary. Many meetings and conferences are cancelled or postponed. To cancel a meeting means it is not going to happen. To postpone a conference means to delay. It is going to happen sometime later. Okay, all these cancellations or restrictions are done to flatten the curve of infected people per day. Look at this diagram and the curve. The curve shows the number of infected people. Here, for example, 50 people per day. To flatten the curve means to do something so that the number of infected people decreases. It means to slow down the spread of the disease. For example, 10 people per day. If you have symptomatic people around, kindly ask them to isolate themselves to avoid the transmission of this contagious disease. Again, some new words. Symptomatic, transmission, contagious. symptomatic as an adjective. It means a person with symptoms, the signs of the illness. Do you remember? Cough, sneezing, fever. Another word, transmission. It's a noun. It means the spread. And contagious. It's an adjective. It refers to any sickness which can spread from one person to another by physical contact. So, if there is a symptomatic person among your friends or family, keep your mask on, like this. Ask the person to go for a test. If she or he tested positive and it is a confirmed case, it is mandatory for the person to be quarantined. It is a confirmed case, means we are sure that the person has the coronavirus. It is mandatory for the person to be quarantined. It means he or she doesn't have a choice. It means the person must be quarantined. In many cases of COVID-19, people get better after an approximate duration of 14 days, while in some other cases, it can be fatal. It means it can kill people. What are the suggestions given by WHO? WHO stands for World Health Organization. Wash your hands frequently with soap. Frequently means often. Wear a face mask like this. Okay. Don't touch your face, your eyes, your nose, your mouth, or your ears. Sanitize your hands like this. Maintain social distancing. It means stay away from other people. Don't get close to other people. Don't hug, kiss, or touch others. Don't visit or invite them over. Avoid large gatherings. Sneeze or cough into a tissue, like or achoo. Okay? If you don't have any, I've already showed you, use the bend of your elbow, like or achoo. All right. Avoid traveling and public transportation. We should try to stay home, not to go out. Work from home or telework if possible. To telework means to work from home using internet, telephone, or emails. By doing them all, we lower the chance of catching the virus, which means becoming sick, and passing the virus to others. If you are worried about vulnerable people, avoid visiting them. The vulnerable people are the elderly or unwell people, or people with compromised immune system. These people are at a high risk of catching the virus. Immune system is your body's ability to fight a virus. To have a compromised immune system means to have a weak immune system, which results in getting sick more easily. If you are concerned about vulnerable people, it means if you are worried about them, try not to visit them. It's better to keep in touch by phone or email for both of you. All you must do is to stay calm, relax, stay positive, stay in means stay home, be kind to others, Everyone is in a hard situation. It's important to spread love and positivity. Stay home, stay strong. We are in this together. It might be okay to stock up on food or any necessary goods, like medicine. Stock up means to have an extra supply, particularly on basic necessities. For example, dry, canned, or frozen food. It's smart to stock up, especially if you're going to self-isolate or self-quarantine for 14 days. What is definitely not good to do is to hoard supplies. Hoard is a verb and it means to have an extra large supply, taking more than you need. As a result, other people can't stock up because there's nothing left for them. We want to protect ourselves and all our loved ones. Be kind and help where you can. I know I couldn't cover all expressions, words, or phrases you might be hearing about coronavirus. Comment me below and say how you are affected by this pandemic. You might be on a lockdown where you're living. I want you to take care of yourself. Stay home, stay safe. Take this time to do more of what you enjoy. Use this opportunity to take your English to the next level. Thank you so much for being here. Thank you so much for subscribing to my channel. Please like and share this video with your friends. See you soon.